everyone. Welcome to American Institute of Physical Therapy in USA. My name is Karthik Yadagiri, your physical therapy doctor. This is a follow-up video for the assessment video which you probably would have seen. All these videos are structured based on one depends on the other. So if you haven't watched the assessment video, I recommend you to watch that first before you come to the treatments. But in this introduction to treatment video, what this video entails or is going to tell you is we are going to make region-specific videos with different treatment options. So in this video, I want to tell you that we're going to teach you different techniques, exercises, and different options you can use for treatment for region-specific. And I also want to give you a highlight that this is the way the regions are divided. So you will see a video on ankle, a knee, hip, shoulder, elbow, wrist, and hand, cervical, thoracic, and lumbosacral. So each of this will have a separate video. In that video, you will see the diagnosis pertaining to that joint and also different techniques and options pertaining to that joint. But that doesn't mean we forget this word, which is regional interdependence. You have to remember, this is not the SFMA method we are following for treatment. This is the region-specific format. I'll be making more videos. How are you going to treat with the SFMA method? But for now, remember, this is very important. Robert Wainwright coined this term in 2007. Very important and powerful, which means each of them are interdependent. If you're treating the knee, you have to look at the ankle and the hip. If you're looking at the hip, you have to look at the knee, ankle, and the lumbar spine. So the joint above and below have to be tested, ruled in, or ruled out before you just focus on the treatment on one specific area. And you'll talk about this in region-specific areas. How does it fit in? So I want to give you a brief introduction of what we are going to do in the next subsequent region-specific treatment options. So I also wanted to show you the different things we might be using for treatment. You might not have all these tools, but if you want any information regarding different kinds of bands, tools, suction, I'm not using the dry needling or taping today, but those are also options for treatment. But I will mention them. But I'll show you treatment with the tools, how I'm going to actually treat if there's a knee pain, ankle pain, and so on. I also wanted to introduce you, you can use just your blood pressure cuff for biofeedback, for feedback for lumbar stability or cervical training. I'll walk when we get to that video. We'll be using suction cups. If I feel there's a need for that, I'll also mention how I'll be using in each region specific. Definitely bands. I love these bands. These are body bands. And if you need more information, if you want to buy these bands, just let me know. You can email to iptaindia@outlook.com. I'll mention the details at the bottom. You can email to us and we can tell you where to buy them, how much to buy them, and also about the tools if you want to buy them. After looking at this videos how to treat, just send either a comment or email to us and we'll get to it. The definite mobility bands, I'll show you how they're going to be useful. There's also different kinds of exercises we'll be showing you, at least 2 manipulation techniques and 2 exercises for each region. You could be using bands like this for mobility, where you could be using for mobilization. You could be using different bands. I've set up in different ways, which we'll be going through in each subsequent region-specific form. But I want you to get an idea of all the kinds of things you might see we'll be using. This is a large, strong band, which you probably won't be using today, or I might based on the region we're going to talk about. So that should give you a brief introduction of what you might be seeing in the subsequent videos when we talk about treatments. So if that is helpful, please follow along and watch our videos for treatment, but I hope you already watched the assessment video before you want to do any treatments. Important disclaimer, if you're not sure about any of these, don't try to attempt it if you're not confident, if you don't have a good understanding. I hope all these are performed by professionals because I'm also going to make some self-help videos where the patients can just follow along for their problems. But if you are a therapist or somebody studying to be a therapist, if you're not confident, just don't use it. Use it at your own risk. If you like this video, please subscribe to my channel for more content. If you have any comments, please share your comments and stories. We'll be happy to listen to you. All right, have a good day.